Hi everyone, John Ross Smith here again. I'm here to talk to you today about a group of muscles called the hip flexors. Now the hip flexors start around the knee area, just below the knee. They come all the way up here. This is part of what we call the quadricep complex. In particular, one of the muscles, rectus femoris, comes up to here and goes into the front of the hip joint and the bones above the hip. You've also got the iliopsoas group, which starts deep in the groin here and comes up and goes across so into the spine, deep into the very front, way beyond the abdominal muscles. And their prime purpose is to lift your leg up. So if you're walking, it lifts it up, or if you're just simply helping yourself get up from a sit-up position, when you're doing this and you come back up again like that, people might think they're doing the abs, but they're not doing the abs alone. They're using the hip flexors to get their legs up. Okay. Now one of the problems you've got is when we're sitting around, especially over lockdown, over Christmas, in this position all day long, this area really shortens, and as a result, it tends to start to drag you forward. So when you're standing, you tend to find that it's going to pull you forward here. So then you're going to compensate with your lower back by overarching your spine here, and that can cause a lot of irritation in the back muscles and facet joints in here. So what we're going to do to stretch that out is, first thing I recommend is have a bit of a walk, get everything going, get the blood going, okay? Don't overdo it, don't overpace yourself, just get out, have a good walk, good 5 to 10 minutes, get the core temperature going so these things start to loosen up. Once you've done that, okay, then there's two ways to stretch. Now the first way is a simple way. Get a pillow to protect your knee, kneel down, nice upright position, hold your tummy in, okay, so suck this in and keep this leg, this way here, relatively straight. Now you're not going to lean back. A lot of people like to stretch the hip flexors by doing this. What they're doing is putting compression through the back, and it's going to irritate their back. It'll make it specific to the muscle. So you're going to keep the leg pretty much straight with the spine, tummy in, and with this muscle here, your buttock muscle, squeeze it to push it forwards. As you push it forward here, you'll feel the tension, especially at the top here, and it will pull all the way down, sometimes all the way down to just below, almost as far as the knee. But just hold this tummy in while you do this to keep a good, stable position, like so, and hold it for about 30 seconds minimum, okay? I like to do about 45 seconds or even 60 seconds if you can. Now when you're doing this, especially if you want to stretch the psoas muscle, so we'll do it from this side so you can see a bit better. Keep it nice and tight, as I said before, squeeze the buttock, but then twist a little bit to the side. As you twist this way, because the psoas is coming diagonally down through to the groin here, you're putting a bit more of a stretch on, so you can twist it if you want as well. So, but don't forget to keep this tummy, so the tummy squeeze it and the buttock nice and tight, so the core's got to be stable at all times, okay? So that's the first one you do. Like I said, 30 to 60 seconds if you can. Just hold that, gradually increase it as you go. So you might find that as you squeeze your buttock, it really pulls down the front of your thigh. So don't go full blast straight away. Gradually increase it as you go. Now, once you feel comfortable to do that, the next level up is to start to stretch the front of the thigh with it, okay? So the best thing to do, again, is keep the pillow for your knee to protect it. Find something you can put your leg up against, okay? And simply let the leg come to here. Put all your weight, of course, ideally on this leg, not so much the back leg, and keep the tummy tucked in as before, and try to get your body back as far as you can, so you want your heel to touch your buttock. So it's exactly the same stretch, it's just that your knee is slightly bent. It's good to have something behind it to help it. Now I like to get to a point where I need to hold it up a bit more because that's quite painful on my knee. I like to get to a point where I can really get nice and close to there like so. And again, keep this tight, nice straight posture. Squeeze your buttocks to emphasise this going forward and really pull through this section here. And again, same thing, 30 to 60 seconds if you can. But don't push too hard, like I said. You can overstretch it and it can irritate it. I mean, when I treat my clients, I like to push them pretty hard. But I mean, if I see you once a week or something, there can be a bit of trauma consequential to the stretch afterwards. But if you're doing this every day, you don't want to be pushing it so it's traumatising it, because you need to recover from that, okay? Right, so give that a try, see how you get on, and see you in the next video. Take care, bye-bye.